If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health.
Honestly, if I were to answer the exact same question, what is Apple's greatest contribution to mankind? I would probably say the iPhone, but never in a million years would I think about healthcare. The thing is, my answer might change in the next couple of years because Apple is coming to healthcare at full speed. Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Steve Jobs died in October 2011 at the age of 56. Tim Cook, Apple CEO, often says that Jobs' fight against cancer had a huge impact on him. He saw him struggle with his disease and with the way the health system is organized. That inspired him to push for the development of healthcare as a branch within Apple. Apple has two areas of focus when it comes to healthcare: hardware, like the Apple Watch, and software, like the Health app. If we talk about hardware, Apple's most well-known step into healthcare is the Apple Watch. It was first designed to be a fashion item, but it is now turning into a fitness and health tracker. Picture that, Apple now sells more watches than the entire Swiss watch industry. That's impressive. But be careful, Apple Watches are not medical devices, and it is unlikely we will see Apple develop a stent or an artificial hip joint in the future. However, some of the functionalities within the Apple Watch have received approval from American and European health authorities, for instance, the ECG. This means that functionality was medically tested during a clinical trial and more recently during the Apple Heart study. But complying with the regulations surrounding medical devices is a huge challenge in itself. And rightly so, it is important to make sure that devices influencing patients' health are safe and efficient. In addition to that, Apple will also have to provide scientific material to back the use of their devices in peer-reviewed studies, which is completely new to them. In the absence of such evidence, physicians aren't very convinced of the benefits that these devices bring to patients. Do they actually have an impact on their health, or do they simply provide more information to worry about? Although the Apple Watch is Apple's most famous step into the medical field, it isn't the first. Back in 2014, the company started developing open source frameworks they called kits that allow developers to create medical apps. For instance, CareKit helps develop care management solutions, and ResearchKit is targeted to medical research. These apps can collect data from a wide variety of sources that are compatible with iPhones. ResearchKit has already been used to develop apps for studies about Parkinson's, about melanoma, or about epilepsy. All iPhone users can be targeted, making patient recruitment and data collection much easier than in traditional trials. Apple's capacity to gather a huge community of third-party developers can also be an important advantage when moving into the healthcare space. This community could help Apple tackle one of the biggest challenges that we have today in healthcare: electronic health records. This market has been dominated by big players for a long time, and because systems are so costly and don't communicate with one another, it is usually hard to enter the market once key players have settled in. But Apple has started making its first moves in this space, signing important deals with American providers. In 2018, Apple also announced it will soon bring EHRs into consumers' phones, breaking that information silo we usually have between patients and healthcare providers. If Apple actually succeeds in creating a central repository for all patients' entire medical records on the iPhone, it could overcome one of healthcare's biggest challenges today. All these products revolve around the iPhone, which is still Apple's biggest seller. In 2020, Tim Cook announced that 900 million people worldwide have an iPhone. Apple is a very big brand known to consumers, and they will leverage this huge consumer base to bring new services to patients way faster than their competitors. It is also worth noting that Apple doesn't seem to suffer from the same bad reputation when it comes to the way they handle personal data. Apple's business model revolves around selling hardware and software, and not personal data like companies such as Facebook or Google. So at a time when consumers are more and more reluctant to sharing their health data because they fear it will be misused, Apple's very clean track record can become a key asset. Last but not least, Apple is very well known for creating seamless user experiences in everything they develop. This positions the company as a leader in medical software where interfaces aren't very friendly, to say the least. So, what can we expect next? First, Apple will certainly add more medical functionalities, such as glucose monitoring to the Apple Watch. Apple also filed a patent exploring ways to capture biometric data through the AirPods. Second, Apple will likely develop medical services. They started with fitness through what they called Fitness Plus, but it could also soon move into telemedicine, as it is suggested by another patent they filed. Last, Apple is building partnerships with key healthcare providers to increase their market reach. As an example, the company partnered with Singapore to reward people based on their activity and when they achieve healthcare goals. So, if Apple continues in this direction, I think I might consider healthcare as one of their biggest contributions to mankind in the next couple of years. If you want to continue this conversation, head over to our website for more content and the unique opportunity to sign up to our next conference. Thank you so much for watching, and I'll see you next time. Bye!